This is a man who's taken several paths less traveled to end up where he is today. He began his professional career back in 1985 as a physiotherapist seeing patients in hospital. 7 years later, after that path was maximized, he branched out into haptotherapy and functional osteopathy, as he felt there was probably some connection between our emotions, how we think about ourselves, and those around us, and our physical health. Fancy that. He founded his own healthcare clinic to this end and spent the next 8 years helping people to heal on an emotional and a physical level. During that time, he discovered the benefits of yoga, and after traveling the world to uncover many different forms and how it can benefit healthcare, he founded a school where they now teach what has been christened Yin Yoga Medicine. By 2010, he had spent 4 years studying biophysical medicine and informational medicine and became an international teacher of biophysical medicine. All this time becoming more and more aware of the integration between the physical body and the human body field. And despite many years of traditional and non-traditional training and laying of hands on people to heal first with pure physical awareness and later far more of an energy and emotional awareness, he's the first person to tell you he still knows nothing about how our physical body works. He's also been discussing at great length one of his own passions, and that's working with animals. And right now, let me introduce to you Mr. Emrik Suichies. Best I could do.
Suichies is a very nice name. It's called Suichies, but it's very difficult to pronounce, I think. Well, I'm very proud to be here and to entertain you a little bit. Because I think performing and education is something which has to do with entertainment. So I hope I can entertain you a little bit with some information. A few days ago, I was dreaming. I was dreaming about something which Harry mentioned yesterday, I think, it was yesterday, about when you're sitting at the beach at the Bahamas, like I do over here, it was 2 years ago, then suddenly, then there's some things coming on, and I was thinking about this image with my wife sitting there and realizing that what you're doing is something very special. But I don't like working. I always say, when you're working, it takes energy. And it must be something like what you do during the day must be fun, and it must be something which is in alignment with you. So this was in alignment with me. And I thought, when we have a remote scanning, it was 2 years ago, then maybe I can do something with animals, like the turtles who were over there, and treat them, but also do something at home. So I liked what Harry said. And then after dreaming, I woke up yesterday. It was downtown in Denver, not yesterday, the day before yesterday. And when I opened my eyes, I saw this. And it was very special because then I realized I was here again. This is my friend Suichies. You will see he's at the back. And we always make a lot of fun because I think that's the key in life. I was sitting there at a restaurant and I wanted to see what could we eat. And then there was this picture. I thought, what's this? So we tasted it. And then I looked up and I saw something with sugar. And I thought, okay, maybe I can find something which is related to glycobiology, like fructose or mannose. But there were all sorts of sugars, but it wasn't the sugar I was trying to find. So then I thought, the same as Debbie, how can I get the trust of you doing my speech? I thought, well, I have to be a little bit in the culture. So I put this one off, and I bought this one. And sorry? The horse is outside, yeah, so it suits with the horse. And Sietse made a picture of me, and I sent it to my wife, and she said, "What?" But it looks very good. Yeah. Okay. Before I go any further, in Holland, it's always when you come somewhere, you bring a present. And I brought a present for you. This is my passion, and it's all about information. It's all about light. It's all about who you are. So I want to share this, and maybe you can get it around. Don't look what's inside. Just take one. That's your present for today. Yeah? Okay. I want to share some information about my experience with animals. And I've been teaching a lot. I've been seeing a lot of animals in human. And then I thought, well, we have used the My Health now for, I think, about 4 years. And we've tested it out. So now it's the time to use it for animals. Usually it's different. Usually start with the animal, but now we started with the humans. And it's very easy to use Provision and My Health with animals. And I will show you. So, who has an animal at home? Look around. How many hands are there? A lot. Has anyone ever used the My Health already? Also. And are there any successes? Who had any successes? Oh, okay. Who didn't have any success? One. Okay. I always say it's very easy to talk about your success, but it's very interesting to see why it didn't work with her. So maybe at the end we can ask you about it. Yeah? Usually it says nothing about the animal. It says something about the person who is treating the animal. So, you're still in? Okay. Great. Very in. Let's go on. I saw this picture and I thought this is the right picture for over here. It has all the information in it. You can see all the colors of the rainbow in this chameleon. And it's all about frequencies. It's all about information. It's about the frequency of light which you have to transfer to the animal with your infoceuticals and with your My Health, but also with yourself. It is. That's what we're going to see.
Hello, I'm Mr. Ed. A horse is a horse, of course, and no one can talk to a horse, of course. That is, of course, unless the horse is the famous Mr. Ed. Go right to the source and ask the horse.
It's very soft.
The answer that you endorse. He's always on a steady course. Talk to Mr. Ed.
It's gone. That's it. I liked what's in the video. It's about a horse, but it's also about something else. Do you know what they say in that? You know it. You know Mr. Ed. What are the words? But no one can. And then the next part. Yeah, and then the next part. Shall we do it again? How can we increase the sound? This one? Other way. This one? Okay, we do it again. Please listen.
Hello, I'm Mr. Ed.
A horse is a horse, of course, and no one can talk to a horse, of course. That is, of course, unless the horse is the famous Mr. Ed. Go right to the source and ask the horse. He'll give you the answer that you endorse. He's always on a steady course. Talk to Mr. Ed.
So what they say is, the horse will tell you what to do. And that's a very, very important message. So when you have your My Health, when you have your provision, you get a screen. It's like a map. But you always have to listen to your own intuition, because the horse is talking to you. Don't forget. We're going to talk about horses, and in Holland we have a lot of horses, over here also. And this is what they call a Frisian horse. And I talked about it 2 years ago, when I was at the other conference. I don't know, were there any at the other conference in San Jose? Yeah? Okay. I talked about a problem with a specific horse, and I will show you in a while what the problem was. This is provision, like how it's in the newest animal vet vision. So I don't want to talk a lot about it, because you all know the screens of provision. These are the ERs. Over here you have the drivers. Very nice pictures. Then the integrators. This is a very important, the mind screen. I use it a lot with animals, because they react immediately when you use mind functions. Then you have this one, very important for not only human but also for animals, because when they don't have the right food, when they don't have the right things to drink, then you get a lot of problems. And this one is very nice, the emotions. You know, a lot of therapists use the horse to mirror what the patient is saying. And when you have this, it says something about the horse, but it also says something about the owner. And I always say, always try to bring the owner with the horse, so you can fuzz both of them. I always use the word fuzz. You know what fuzzing is? Fuzzy bear, you know, I think. To fuzz is to adjust. Just like when you have a radio and the signal is not right, you have to find the right signal, and then you have the right things on it. So fuzzing is, for a lot of people who are not medical educated, a word, and they say, what fuzzing? And then you can explain what you're doing. Because when you say, I'm treating the horse, then everyone thinks you're a vet, and you're not. So when you say, I'm going to fuzz the horse, then you can explain what you're doing. It's very easy. And of course, this one we have. Do you know what this is? Sorry? A feeder? It looks like it. It's a penis. It's a penis of a horse, and this horse had a very big problem. You can see there are all rats on it. It was infected by the papillovirus, and no one could do anything about it. So the vet came 2 times a year, and he shaved it off. And it was very painful. And the lady who came to me, she said, "Can you do something about it?" And I said, "Never seen it before, but we can try." So we were starting in June 2013. And we used the pharmaceuticals ET4 and BFA because it was from the scan then. I didn't have the provision for animals, so I just used the provision for humans. And she used ET4. She didn't do it in the water, just behind the ears. She first tried to put it in the mouth, but it was a bit tricky. So she put it behind the ears. And then she bought a MyHealth, and she used the MyHealth with BioCell. She used Chronicle Balance, Matrix Carrier, Immunities, ESR, Inner Peace, all 1 minute, not more than 1 minute. And she did it 3 times a week. And then, after 4 weeks, it looked like this. And then after 6 weeks, it was healed within 8 weeks. And it's still healed. So that was my start to say, I'm going to do more with animals. I'm not an expert in animals. I don't know nothing about horses. I was a bit scared for horses because I fell off a long time ago. And still, I'm seeing a lot of horses now. Like these. A big problem is eczema with horses. Eczema around the eyes and at the back or at the tail. They start to rub themselves and it goes open and it's terrible. And no one has a cure. In Holland, no one has a cure. So we started with some horses to treat them. And I show you the results. This was one of the horses who had a specific fungus. It looked like this. And then after 4 weeks, MyHealth and pharmaceuticals, it went away. It looked like this. You see, it's almost gone. After 8 weeks, again, no fungus. The vet, he said, that's impossible. And I thought so too, but it was possible. So now we treat a lot of horses like this. And I'm not doing it. I've got an MD who is having a passion with horses, and he is all over the country doing his thing. This is something which is also, I don't know, you know what laminitis is? An inflammation. It's an inflammation, you see it over there, and the horse won't walk anymore. It stays like that. And when it has that inflammation on the front feet and on the back feet, it will not move. That's also very difficult to treat for normal vets. So I will show you a little video, and I will get the sound off because it's a lot of noise. I think this one. Yeah. Before the treatment, this horse was walking like this. And this was a treatment from a friend of mine. He is a vet in Belgium, and he treats also a lot of horses. You can see it limps a bit. And of course, the horse is in pain. So after the treatment with My Health, 2 weeks, 2 times a week, and some pharmaceuticals which came from the provision, there were no problems anymore. And it's just one case. I've got lots of cases like this. Next one. This was a very good one. This is what you see when a horse has real severe inflammation. It will not move. It won't move because it's in severe pain. Don't try it. After the treatment, 1 week, 2 times. So there's a lot to do for you all. And it's so easy. It's very easy. We move on. This animal isn't real, Harry. No, it isn't. Sorry? Well, dogs are also animals which you can treat very good, which you can fuzz very good. Let's keep it on fuzzing. I've got a very special case. This was the first dog which appeared to our clinic. And you must imagine, we have a clinic in Holland with 40 MDs, physiotherapists, all sorts of therapists. And then there was a woman coming with her dog. And this is my colleague. And she said, well, I'm going to treat that dog. And I said, in the clinic? I said, yes. I said, no, we have to find a different space because we cannot have all sort of dogs in the house. And then sometimes maybe it becomes, we get a horse and we get all sort of things and cows. No, we cannot do it. So we prepared a different space, and as he was fuzzing the animals. This is Robin. Robin is a dog which he is now 17, but he was 16 years old. And this was the video we got. 16 years old, and he walked like this. And they had to buy something because he was falling down. And then the vet said, well, he's 16. Give him something and he will go to the other space. But the owner was very attached, and she said, well, can't we do anything? And Annie, she heard it, and she said, I'm going to treat her. I'm going to fuss this Robin. That was June 2013, and you will see what happened. So it had a problem with the nervous system. After 5 fuzzing treatments with the My Health, still 16 years old, but it's running. Yes. 2 pharmaceuticals. Yeah. Just following the protocol. So that's very good to see. Sorry? Ears again, yeah. And you can also, with dogs, it's easier to bring it into the water, just like cats. But with horses, it's a bit difficult. So on the provision, you have now a screen in which you can bring everything alive, bring your own map alive. And when you look at this and you see where the problem is, and the pancreas driver is the problem, the only problem, then of course you take the pancreas driver. And the small intestine Do you see what the problem was? The crown chakra. So we used the crown chakra above the head. Not longer than 1 minute. 1 minute is usually enough. We go on. You know these screens. It's not so... And this was April this year. Still going strong. No extra medicine, no my health, still alive and walking. And 17 years old. It's in Spain. They were on holiday. So I like that very much. A few other cases. We did an experiment. In an elderly home, we worked for almost a year. And in 4 months, we saw all the elderly people with all sorts of problems. And one of the problems was they had wounds on their legs and it wouldn't heal. And we said, we try to bring in the My Health. And by bringing in the My Health, all the wounds in the complete elderly home were healed in 2 weeks. It was amazing. So the manager and the directors of board of directors, they bought directly 10 My Healths, and all the nurses are working with it. And now another extra elderly homes are working with the My Health. This is 2 weeks. This was also a lady who was over there, and this was our biggest success story, so I will tell you. This lady was 89 years old, and she had to get an amputated limb because this is a black wound. When this is open, it gets infected and they have big problems. So to prevent it, they will amputate it. And this lady was also in that elderly home. And then we said, okay, you go in the protocol 2 times, just 2 times. We use the My Health and we use the infoceuticals. And within 2 weeks, it looked like this. And when we did a presentation for all the doctors, the MDs over there, the MD said, what Photoshop program did you use? They couldn't believe it. But it was real. So I thought, when you can do this with humans, of course we can do it with animals. This dog had a big problem because it was open for 2 months and there was infection and it wouldn't heal. So we said, we're gonna fuzz it. It looked like this. And it was on antibiotics and it didn't work. 2 weeks using My Health, skin, BioCell, ESR, inner peace and balance made it heal within 2 weeks. So I was amazed when you see these sort of things within such a short time, then we can do a lot with our system. This dog had swallowed a stick and it was like this in his throat for a long time. They had to operate it to get it out, and it had a lot of slimes and it wouldn't heal. And we also used the My Health. And of course we used for this one the ERs. And then within 2 weeks it was gone. He was better. So I thought, when you can do this with dogs, you can also use it for cats. You've seen these screens already, or not? First time? First time, okay. Well, there's a cat. And the rest is all the same. And this is our cat. And please look at this cat. This is Sientje, and she's very grumpy. And you can see it in her whole energy. And you put it within her piece, and her tail will stay like this, and it takes almost a minute, and then you will see what will happen. That within a minute, already you can see it's something different in her energy, and then it's okay. Within a minute, she sleeps. Yes, Andrea. 1 minute, I have for half an hour presentation. But we can do the rest after. Yeah? Okay. Last, and this is how it goes on. So when you keep the My Health over there, it's okay. But 1 minute is enough. That's the message.